have a 5-minute Q&A sessions. And all participants in this breakout room can ask the presenter question in either English or Indonesian. Participant can use the raise hand feature or write their question in the chat box. And we highly suggest the presenter to may respond the question in the Q&A session in English. Then without any further ado, let's start the presentation from the first presenter. I believe is Miss Dewi Erowati. Am I right? Or Miss Yola Kumaro, who will present the session? Oh, Dewi. Okay. Okay, Miss Dewi, the screen is yours. 10 minutes.
Okay, thank you very much, Dr. Vita. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen. First of all, I would like to thank Poltekkes Kemenkes Bengkulu for holding the second Bengkulu International Conference on Health. It is an honor to be here to representing my team, which is me, Dewi Erowati, Yola Humaro, and Alkausari Aziz. We are lecturers from Department of Nutrition, Poltekkes Kemenkes Riau, and the title of my paper is Perceptions and Readiness of Poltekkes Kemenkes Riau Students in Implementing IPE Based of Integrated Real Work Practice. Okay, next please. This paper contains first, the introduction, second, the material and methods, third, results and discussion, fourth, conclusions, and five, the references. Next, please. Okay, first we begin to part one, introduction. The interprofessional education, the basic principle of IPE was collaborative practice between two or more health professions. The several studies have shown that IPE promotes interdisciplinary collaboration and teamwork, reduces the barriers and preconceptions prevailing among various healthcare groups, and promotes professional competencies. Next, please. So, how the implementation of the IPE at Poltekkes Kemenkes Riau? Poltekkes Kemenkes Riau has implemented the integrated real work practice, which involved the study of nutrition, midwifery, and nursing. And the IPE-based integrated real work practice program in 2022 was the IPE-based controlling stunting during COVID-19 pandemic in Kampar Regency to support the Center of Excellence, or COE, of the Stunting Study Center of Poltekkes Kemenkes Riau. The purpose of this study was to analyze the relationship between students' perceptions and readiness in implementing the IPE based of integrated work practice of Poltekkes Kemenkes Riau. Then the next session was the material and methods. This study was the descriptive study using a cross-sectional design. And the sample technique was accidental sampling of final year students who attended the integrated work practice. The sample was 230 students consisting of 76 nutrition students, 63 midwifery students, and 91 nursing students. And the instrumental of the study was the Interdisciplinary Education Perception Scales, or IEPS, to measure the student perceptions, and the RIPLS, or the Readiness for Interprofessional Learning Scale, to measure the student readiness. And then the next session is the results and discussion. So from this study, the average score of Interdisciplinary Education Perception Scale, or IEPS, was 62.6%, which is in good category, and the Readiness for Interprofessional Learning Scale, or RIPLS, was 64.2, which is good category. So both of the readiness and the perception of the student for the EPE is very good. And then there was a statistically significant relationship, which the p-value was 0.000 or p less than 0.05 between perceptions and readiness. The results of the previous study revealed that midwiferys, nurses, and nutrition students had higher perceptions of post-interprofessional learning after participating in the IPE program. This shows that the IPE program can increase students' positive perceptions about their readiness to work in multidisciplinary teams. Next, please. The four core competencies of the IPE was first, the value of ethics for interprofessional practice, which means the work with individuals of other professions to maintain a climate of mutual respect and shared values. Second, roles or responsibilities, which means use the knowledge of one's own role and those of their professions to appropriately assess and address the healthcare needs of patients and to promote and advance the health to populations. The third, interprofessional communication, which means the communicate with patients, families, communities, and professionals in health and other fields in a responsive and responsible manner that supports a team approach to the promotion and maintenance of health and the prevention and treatment of disease. The fourth is teams and teamwork, which means apply relationship building values and the principle of team dynamics to perform effectively in different team roles to plan, deliver, and evaluate patient or population-centered and population health programs and policies that are safe, timely, efficient, effective, and equitable. Okay, next please. The IPE best integrated to real work practice at the Poltekkes Kemenkes Riau. First is determine and prioritize family problems and accountable grounds. So in this case, we use the data from primary healthcare or posyandu cadres, or the students do the home visit, which means they assess directly the patients. Next, the second is determine the factors that cause the problem in accordance with the basics of theory. So in these examples was the case of the how the students determine the factors that cause the problem. So in this case, 10 years old girl who have painful urination, and this caused by the bowel habit bath, and they check the red urine fever or the infection. Or the next case, they fall history and trauma. And also they check the history of being in touch in the public area and how deep sexual. That also they are caused the how they caused the 10-year-old girl painful urination. Okay, next. Next is the establish a problem-solving intervention plan in accordance with the theory and the existing conditions. So they describe how is the problems and how the theory. Then usually there is a gap between the theory and the problems. So the theory and the reality and the in the community, so they have they can make problems. Okay, next. And then the student form groups consisting of nutrition studies, nurses, and midwives to develop problem assessment, planning, intervention, and monitoring evaluation of the clinical care provided. So, since this is from the three study, which is nutrition, nurse, and midwife. So they make a mapping how they can contribute based on their professions, the competition plan, and the target, and responsible professions, and other team engagement by each perspective.
I'm
Next.
sorry, Mrs. Devi, you have 1 minute left. Oh, this is a conclusion.
Okay, thank you. So the conclusion, the IPE can implement it successfully and benefit students in real community problems. Poltekkes Kemenkes Riau students already have the perspective and readiness in implementing IPE. Third, the students can solve household health problems in accordance with the professions of nutrition, nurses, and midwives. And the fourth, the program should be evaluated and improved to assure all students from different schools to get equal benefits. Okay, next. And these are the references. Okay, that's all. Thank you very much for your attention and this great opportunity. The advices are welcome. Thank you, Dr. Vita.
Thank you so much, Mrs. Devi. It's really great presentation. So before I ask question, is there any participant will ask any question? No. If there is no question for participant, I will give a change for Dr. Demsa Simbolon. Do you have any question for our first participant, Dr. Demsa?
Okay, thank you, Miss Vita. Congratulations for to Miss Erowati or Miss Devi. Miss
Dewi, Bu. Dewi.
Oh, Devi, Miss Devi. Okay, congratulations to Miss Devi and team. I have a question. The first, how this study categorize perception and the readiness? Readiness, yes. Because in the method, the research not explain how the categorize. Please, Miss Devi. Miss Devi.
Okay, thank you for the question, Miss. And the perceptions and the readiness of this study is conducted by the instrumental, the questionnaire. They consist each of them 18 questions, and the results, the scoring result is in a good category. Maybe I only explain less in the paper. Thank you very much for the advice. I will add some explanation about that.
Okay, please insert in methods. Okay. I know about how about the validity the instrument.
Okay. These instruments already used by the previous study, so that I think already valid and reliable.
Are the instrument is used in the place other
in other place in Indonesia?
Oh, in Indonesia.
Yeah.
I know about what the main implementation IPA based of integrated real work practice or same with PKLT.
PKN. In
PKN.
Poltekkes Kemenkes Riau, we have PKN, praktek kerja nyata terpadu, which contains the three study in Poltekkes, midwifery and nurses and the nutrition. students.
What
They
the
collaborated.
The collaborated.
Yeah.
Okay. Are the PKN is designed to the riset or the pengabdian masyarakat?
It's more for the pengabdian masyarakat, but in this study, I use the research from their how they perception and their readiness for the PKN, in the PKN, how they implement the IPE in this PKN.
Okay. Please explanation. What are the limitations of this study? Because in the paper, I can see.
Oh yeah. Okay. Yeah. I didn't put the limitation yet, and I think the limitation of this study, maybe we just use the instrumental for to analyze the readiness and the perceptions of the students, but we don't explore more about how they implement the IPE. I think it should be the next project. Maybe we can explore more how they can solve a problem based off the IPE.
Okay, please insert the limitation in
Okay,
the
ma'am.
discussion. Okay.
Yes, ma'am.
One question. Can the result of this study to be generalized to the world population?
Okay.
Population in Poltekkes other.
Okay, I think
because the sampling is accidental sampling.
yeah, cannot be generalized. Okay, I think since the score of their perceptions and their readiness already high, already in a good category, so that they can implement the IPE, but in the other place, maybe we should explore first how their score of the readiness and the perception before we explore more about the implementation of the IPE. So yeah, because of the technique was the accidental, it cannot be generalized. Maybe I can add in the limitation also.
Okay, thank you, Miss Devi. Okay, I think enough, Miss Vita.
Okay, thank you, Dr. Demsa.
Thank
Sorry.
you.
I have a question for Dr. Miss Devi. It's just one question actually. So I
Thank you.
didn't see any statistical analysis method in your paper. Could you explain about this? What kind of statistical method you use? Because I just see the p-value without any further explanation.
Okay. Thank you, Miss Vita. I forgot to add this. This is using chi-square, and we run in the SPSS so that we get the p-value, which is there is a relationship between the perception and the readiness of the students.
Yes, in the result, nothing p-value, nothing analysis, nothing description about the sample, but in abstract, ada itu.
Yeah, they mentioned about it.
I will add that. Thank you.
Yes, but Mrs. Dewi, I will highly recommend that you put a prevalence ratio or a odds ratio, so it make audience or reader give clear explanations. It's just a simple tick on the SPSS, and you get the result.
Okay, thank you.
Okay,
Thank you, Dr. Vita.
For
Thank
Mrs.
you.
Dewi,
Thank you so
our
much.
first participant.